Hi, I'm Dr. Broni, the lead tutor at MedCognito. And at MedCognito, we help doctors just like you to pass the Canadian licensing exams and to begin successful medical careers in Canada. Now, listen closely. You don't need MCQ1. You don't need the NAC-OSCE, and you don't even need Canadian immigration status to apply to this program. So far as you are a trained family physician anywhere in the world, listen, this is the news. British Columbia is calling. British Columbia. We call it BC here. British Columbia is calling. In fact, it's a very beautiful province with a very good weather. And right now, British Columbia is calling you through the PRA BC program. And this video is going to break everything down for you, step by step, by step, by step. So by the end, you will know exactly what to do, when to do what to do, and how to start your journey towards becoming a licensed doctor in BC. I'm really excited. Woo. The reason is because, you don't need to go through the usual hurdles. And so, doctors, let's get right into the game right away. The Practice Ready Assessment program in British Columbia is what we call PRA BC. Okay, and it's a government-backed program which is designed to assess and license international trained physicians who completed their residency outside of Canada. It's not a new program, but in 2025, this year, something serious happened. Something major shifted. And that is what I want to share with you. If you are listening to this video before July 7th, know very well that the plan is that effectively July 7th, 2025, the MCCQE1 and the LMCC are no longer a requirement for this pathway, which is the Practice Ready Assessment BC. Now, they made a major change as well in 2023. Since 2023, you don't need the NAC-OSCE exam as a requirement for the Practice Ready Assessment BC. So you see that usually in the Practice Ready Assessment, you would have needed MCQE1, NAC-OSCE, TDM, and your English exam. Now, there's not going to be any MCQE1 come July 7th. Number two, there's not going to be any OSCE. So the only exam left is the therapeutic decision-making exam. And I'll take my time to break that down as we go through the video. So that means that if you are fully qualified, you could be just one exam away and one assessment away from becoming fully licensed in British Columbia. Okay, so let's talk about eligibility. Woo, I'm really excited about this. To apply for the PRA BC, you need to meet these requirements, and I'm going to spell them out for you right away. Number one, you must hold a medical degree from a school which is listed in the World Directory of Medical Schools. That's the first thing. Number two, you must have at least 2 years of postgraduate training in family medicine that led to your registration as a family physician in your home country. Number three, you must have completed these core rotations during your training: internal medicine, general surgery, pediatrics, psychiatry, emergency medicine, obstetrics and gynecology, and at least 8 weeks in family medicine. Number four, you must have 2 years of independent practice as a family physician. Number five, you must have worked at least 960 clinical hours in the past 3 years. Number six, your credentials must be assessed through physiciansapply.ca, and the credentials should include your degree, your proof of rotations, and your passport. And finally, you need the proof of English language proficiency. You submit your professional CV that explains all your past clinical and non-clinical activities. Look, and if you meet these requirements, you can apply even if you are not in Canada. So whether you are back home in Africa, Nigeria, Cameroon, Togo, Ghana, Benin, Egypt, Algeria, anywhere, or you are in Asia, you are in India, Pakistan, Iran, Iraq, anywhere, Hong Kong, you can apply even though you are not in Canada. So now let's talk about the application process itself. you don't need to apply directly to PRA BC. You don't need to apply directly to Practice Ready Assessment BC. Instead, what you need to do is to go through an organization called Health Match BC. Health Match BC. Now, if you've already registered with Health Match BC, all you need to do is just log in, upload your most recent CV, and send them a message indicating your interest in the PRA BC. If you are not yet registered with Health Match BC, then you need to follow these steps. Go to www.healthmatchbc.org. Then the second step, select physician. Then the next step, under primary specialty, I need you to select family practitioner or general practitioner. And then the fourth point is you will check a new box which will appear, and you have to click, I would like to be considered for Practice Ready Assessment BC. And the fifth point, upload your CV, fill out the application form, and submit it. Simplicity. It's that simple, and you are done. Okay. So once you apply to the PRA BC, your file will be reviewed. If you meet the pre-screening criteria, they will forward the application to the College of Physicians and Surgeons of British Columbia, which we also call the CPS-BC. Now, the CPS-BC will do a full assessment of your entire file. And if they approve you, you'll be invited to sit one exam. You remember that I mentioned that exam when I started this video. That is what we call the therapeutic decision-making exam. And guess what? We are here to help. We help teach it, and we are going to guide you through it, okay? In fact, the therapeutic decision-making exam was the first exam we started teaching in MedCognito, well put together, well planned, with all the tutors on board so that you can really be able to ace it. So if you get to the TDM portion, don't worry, we are here to guide you through it. Now, the TDM is the only exam you need to pass for the PRA BC. And it does not test theory only. It tests how you're going to treat real patients, your ability to make safe and evidence-based clinical decisions so far as medications and management of patients are concerned. And this exam will include drug therapy, non-drug therapy, safety precautions, and monitoring. So, for example, you got to know various drug therapies for various medical conditions, and you've got to learn these medical conditions in view of the MCC objectives. So you realize that if you've read a little bit about MCQ1 objectives, those are the topics you need to review so far as the TDM is concerned, but focus on the management only. Pharmacological, non-pharmacological, drug interactions, drug dosing, how to write prescriptions, how to admit patients, fluid requirements, medications in children, medications in pregnant patients, medications in patients who have renal issues, and how you're going to adjust those medications, and how you're going to monitor some special medications, right? These are the things you need to know. Now, if you are listening to this video, you've got to just go to the therapeutic decision-making exam website and check the upcoming dates. Okay. Now, the beautiful thing is that you can take the therapeutic decision-making exam anywhere in Canada. You can take it remotely from anywhere in the world, so far as you have stable internet and a quiet space for remote proctoring. So you can even take this exam in your room. So you realize that with the PRA BC, you can do everything even before you get here. Or if you are already here in Canada, you can still take the exam at home or at an approved exam taking place. Okay, and here's some of the good news. If you pass the TDM, then you get into a 12-week clinical assessment, and that is where all the magic happens. So after you've passed your TDM, you receive an eligibility letter from the College of Physicians and Surgeons of British Columbia. You'll be referred to the health authorities in BC for interviews. And each PRA BC intake is connected to specific communities in need. So that's another thing. When you also get to the interview preparation, call on us at MedCognito. We are here to help and guide you and give you mock interviews, to quiz you so that you are really prepared so far as interviews are concerned. So you are connected to a particular community, especially rural and underserved communities. And what I want to say is this: if you really want to improve your chances of getting into the PRA BC, I'll strongly advise that you complete some of these. Make sure that you've completed your ATLS. ATLS stands for Advanced Trauma Life Support. Make sure you've completed your ACLS, which is Advanced Cardiovascular Life Support. Which then you also have to make sure that you have your PALS, that's PALS, which is Pediatric Advanced Life Support, and your NRP, Neonatal Resuscitation Program. These help to boost, your candidacy and to bring you forward so far as the PRA BC is concerned. And if you want to work in a rural setting, these certifications make sure you are more than competitive for that. Okay, so once you have been selected, you begin your 12-week clinical field assessment. And if you talk to some candidates, you'll be hearing the acronym CFA. CFA, that's the clinical field assessment. Before that, you will attend an orientation in Vancouver, and you'll be assigned to different BC community where you work under supervision as the most responsible physician while you are going through evaluation. And how does that work? You are assigned to a doctor, a group of doctors. They look at how you interact with patients. They look at how you write your clinical notes. They look at how you prescribe medications. They look at how you write your admission orders. They look at how you write your discharge orders. They look at how you write referrals to other specialists. They look at how you interact with other colleagues, patients, relatives, other people in the medical fraternity, like the nursing staff, like paramedic staff, like, housekeeping, everybody. So that is how the assessment goes, okay? The assessment is not a training. It's rather an assessment to confirm that you are, number one, safe, number two, you are competent, and number three, you are ready to work independently in Canada. Now, once you successfully complete your assessment and sign your return of service contract, that means that you sign a contract that you're going to work in the community you are assigned to for a period of time according to the contract you are given. You become eligible for permanent residency through the BC Provincial Nominee Program. Ooh. And they focus this on the health authority stream. So this means you and your entire family can begin a brand new life in Canada, right? So let's recap. Let's recap the PRA BC program. No MCQE1, no NAC-OSCE, no Canadian residency is needed to apply, okay? Just your training, your experience, and your willingness to serve the wonderful people of British Columbia. If you are ready, PRA BC is also ready for you. And all I need you to do now is to visit www.healthmatchbc and begin your application today. And if you need help to prepare for your therapeutic decision-making exam, then visit us at www.medcognito.com, or you can give me a shout on WhatsApp and we'll be here to help you. We offer expert coaching, mock exams, and support every step of the way so far as your integration into the Canadian healthcare system is concerned. So I'm Dr. Broni. I want to see you get licensed. I want to see that you are thriving, and I want to see that you are practicing medicine and this career that you love and you've committed your heart to. So don't just dream about it. Start the journey with us today. See you.